Benzodiazepine. So this is very important topic if you want to understand that the drugs that we use for CNS, Central Nervous System. Benzodiazepines, the mechanism of action in this picture you could see that normally what happen in our hypothalamus, the GABA bind with these uh, neurons and receptor activate and chlorine influx happen and chlorine will be released and it will decrease the sympathetic nervous system activity by decreasing the number of action potentials it is generating. So that is what normally happening. Benzodiazepine is doing is that they bind with GABA A alpha 2 receptors here. That GABA A consists alpha 1, alpha 2, beta 1, beta 2 and gamma. They bind with mainly alpha 2, GABA A alpha 2 and it will enhance the action of GABA. It means when we increase the action of GABA, it will increase the chlorine output and it will decrease the sympathetic nervous system activity by decreasing the action potentials. So you have to understand. So normally what is happening is this GABA is inhibitory neurotransmitter. This inhibitory neurotransmitter bind with receptors, it will release chlorine and chlorine will reduce the sympathetic nervous system activity by reducing the action potentials. Benzodiazepine drugs, what is doing is they bind with adjacent receptor which is GABA A alpha 2 and it will enhance the action of GABA when it is binding with the receptors and it will increase the consequence suggest which is chlorine is doing and it will increase the frequency that is chlorine um, is going through and that is what happening. So you have to understand. So normally what is happening, GABA bind with receptor, it will cause chlorine output and chlorine will decrease the activity of sympathetic nervous system. Benzodiazepine as a drug, what is it doing is it will enhance the function of GABA and as a consequences it will release more chlorine into nerve terminals and it will decrease the activity of sympathetic nervous system. So benzodiazepine is what you have to understand. So classification, there are short acting benzodiazepine, intermediate acting benzodiazepine and long acting benzodiazepine. Short acting mnemonic is atom. These every drug are ending with solam or cpam. Atom A alprazolam, T triazolam O oxazepam, M midazolam. So as you can see, every drug ending with solam or cpam. Long acting ones are mnemonic is FCD, pluracifam, clonazepam, D for diazepam. In next video, we will talk about barbiturates, but compared to barbiturates, there are good effects from benzodiazepine. Nowadays, barbiturates are less uh, used in practically, but barbiturates, mainly phenobarbital, it is very good for anticonvulsants effect. But actually, nowadays they don't very much use in. So why benzodiazepine are good compared to barbiturates? There are several reasons. It is good for natural sleep and it has less hangover effect, and it has less abuse, less dependence, less withdrawal symptoms, and there is present antagonist as well. So overdose of benzodiazepine, we could use this benzodiazepine antagonist. We call this flumazenil. Flumazenil. What is the mechanism of action? So above we talked what is happening, what is the mechanism of action. So this is 3 points. increase frequency of chlorine ion channel opening, increase duration of opening of chlorine ion channel, decrease initiation of action potential. So if someone asks what is the mechanism of benzodiazepine, is it will increase or enhance the action of gamma. Consequently, it will increase frequency of chlorine ion channel opening, increase duration of opening of chlorine ion channel, decrease initiation of action potential. What is the pharmacokinetics of benzodiazepine? Normally, usually, oral route is prepared. So we take benzodiazepine orally. Effects and indication: anti-anxiety drugs, sedative hypnotic, anticonvulsant or epileptic, pre-anesthetic for muscle relaxant. For these five indications, we could use benzodiazepine. If patient is having anxiety, we could recommend benzodiazepine. If patient cannot sleep, as a sedative and hypnotic, we could prescribe this benzodiazepine. As anti-epileptic drug, pre-anesthetic medication, in general anesthetic we talked about those things, and for muscle relaxant. Common side effects is scam, sedation, congenital impairment, asthenia, motor incoordination, and um, dependence, tolerance, and withdrawal symptoms. Normally, common side effects for phenobarbiturate or barbiturates and benzodiazepine are physical and psychological dependence. First one. Second one is withdrawal symptoms. Withdrawal symptoms. Those are the main two things: dependence and tolerance. Dependence, tolerance, and withdrawal symptoms. Three things: dependence, tolerance, withdrawal symptom. So, when you remember side effects, you have to remember it as system wise. In CNS, they will cause daytime sedation and sleepiness, asthenia, cognitive impairment, confusion, motor incoordination. Cardiovascular, cardiac depression, rate will be reduced. Respiratory depression, respiratory rate will be reduced. Sometimes hypersensitivity reaction, skin rash, drug induced dermatitis, psychological, dependence and withdrawal symptoms. Usually benzodiazepine are not used in pregnancy because they cross placental barrier, and nursing mother, benzodiazepine are lipophilic, so it will mix with maternal milk. And myasthenic patient we do not use as well in benzodiazepine because they have muscle reduction effect and acute depression. Benzodiazepine antagonist is flumazenil. Normally benzodiazepine are metabolized in liver, but there are three benzodiazepine that are not metabolized in liver. Mnemonic is out the liver. OTL. O mean oxazepam, T means temazepam, L mean lorazepam. So as an example, if patient having liver cirrhosis, also we have to use benzodiazepine. Which benzodiazepine will you use? This one, extrahepatic metabolic benzodiazepine, because liver is not functioning well. And benzodiazepine made DC by special indications and mnemonics. In upcoming videos, we talk about anti-anxiety drugs, hypnotics, and anti-epileptic drugs. Those three indications mainly we use benzodiazepine. What benzodiazepine use? Just remember mnemonic. If we are talking about insomnia, we take DF-NAT. D means diazepam, flurazepam, nitrazepam, alprazolam, temazepam, triazepam. When you are talking about anxiety, which benzodiazepine used in anxiety is D-cola. D-cola. D means diazepam, C mean clonazepam, O mean oxazepam, L mean lorazepam, A mean alprazolam. Anti-epileptic benzodiazepine are DLC. Diazepam, lorazepam, clonazepam. This is very easy and very important. If you remember mnemonic, know which benzodiazepine are used in each pathology. If patient having insomnia, What benzodiazepine they are using? DFNAT. This is mnemonic. Diazepam, flurazepam, nitrazepam, lalproxylam, temazepam, triazepam. And anti-anxiety, it is D-cola. Anticonvulsant or anti-epileptic, it is DLC. So that's how you easily remember benzodiazepine. So just remember what is benzodiazepine is doing. They enhance the function of GABA. GABA, what is doing GABA? They open chlorine channel and chlorine will be released, and chlorine is, we know it has inhibitory effect. No, in physiology we know it's chlorine has a inhibitory effect, because plus will be neutralized by this is negative chlorine, and it will decrease sympathetic nervous system, and it will decrease action potentials that are producing sympathetic nervous system.